Hello again. We're here at our corporate offices at CCMS, Complete Care Management Services. And I want to talk to you. This is the last week, and I want to talk to you about something that's so dear and near to my heart, the National Nutrition Month. And you can't begin to understand the value of nutrition and how it plays a major role in being able to manage those chronic diseases. You know, today we have a group of doctors that come in and we review the readmissions that come into the hospital in the last 30 days. And you'd be amazed how many times the loss of appetite due to meds or medical conditions, Alzheimer's, dementia, will lead to people not either hydrating properly or eating the right amount of foods or eating the correct foods or not eating foods at all, and how that has a tremendous effect on the quality of life for those people. CMS helps seniors maintain their healthy life through care coordination. That is one of the things that we're focused on heavily. Nutrition is one of those things that we tell our coordinators to be on the lookout for, and we find it from not having enough money to be able to buy the foods and their services out there, psychosocial and social services that are out there that we can pair them up with that can resolve the problem. But if they're not found, if you don't see them, if you don't get them enrolled in them, they're not going to enroll themselves in there. It just takes too long. It's a cumbersome process with passwords and documentation that needs to be submitted and so forth. So we help along the process because nutrition is such a key factor. Again, thank you for giving me an opportunity to be talking to you today, the last week of Nutritional Month. You know, CCMS talks about, you know, and believes in the whole person approach, the quality of life approach. And that has to be when we put all the factors in the care plan assessment. What is a care plan? Well, it's sort of a prescription of what it is that we're going to be doing. What are the priorities for that particular patient? And it could be as simple as, and the first item could be, hey, let's resolve the nutritional factors, because if we do, and we can talk to them about hydration, if we can monitor those things, then we're going to be able to be more successful in the managing of those diseases with those patients. It's an incredible thing that we can do, not a big thing, it's not a medical thing, but you'd be amazed how much this social determinant of not being able to have appropriate nutrition plays a key factor in being able to maintain those patients at home for quality of life. Healthy resources is important, you know, and seniors have accessibility to healthy resources. They just don't have the ability to get them. So to have a team like ours is out there that's scouring the social determinants and getting those social determinants backfilled so that the patient has a great opportunity to be able to receive those services that are out there is incredible. And again, you know, it's what a great opportunity to be able to be with you here, you know, this last month of nutrition, the nutritional month, the month for nutrition, and what a key factor it plays in everything that we do. It's good that, you know, our name is Complete Care Management Services because it sort of ties in with the nutritional factors and all the other psychosocial determinants that are out there. But this being Nutritional Month, you know, we want to tell you a little bit more about it. And, you know, we've been telling you about the importance of it and how it plays a role in the individual's capability of being able to manage their day-to-day activities and their disease as well, and how they can impair the nutrition, hydration piece can impair that. I don't want to tell you that the secret is getting the right food out there if the patient's not going to take it. If the patient's not going to eat it, then you can lead the horse to the water, but if the horse won't drink the water, it doesn't make any sense. So, you know, I think that the key thing is going to be our care coordinators and our physicians in the home being able to look at those social determinants that are there, whether it be depression, dementia, Alzheimer's, and the levels of those diseases that sort of have that person not feel well enough so they don't eat the appropriate foods, and they don't drink the right amount of food, liquids. You'd be amazed how much, the eating or drinking fluids, and let's talk about fluids for a second, part of nutrition, but dehydration is a key factor in the decoupling of those diseases. So that means that decoupling, when I say decoupling, I mean that if you have a lack of hydration or you're dehydrated, then that is the beginning of decompensation with multiple diseases. If you have renal failure, if you have heart disease, and you have to be careful also with some of these diseases, you can overhydrate and then the body doesn't have, or the heart can't manage that large amount of water, and then it circulates around your heart or your lungs, or accumulates in your lungs and your heart, and that's a bad thing too. So knowing your patient, knowing what they need is very, very important. Not giving them more than what they need, but making sure they're taking enough of what they do need. So I give a lot of credit to our care coordinators. They're in the home. They're an incredible resource for us. Again, some of them are very, very well trained. We retrain our people here every month, and we sort of bring our chief medical director in here to chief medical officer to retrain them in what those diseases look like, from not only from a nursing standpoint, but from a physician standpoint, and trying to get them to understand what the physician needs as far as information, not what they're seeing and what they're documenting, but more of what can we ask the patient that the doctor would be able to key on and say, hey, we need to make these decisions. Obviously, when we find nutritional instability in the patient's home, again, whether it be hydration or dehydration or on the food side, we need to backfill those things, and we need the care coordinators to be involved with the patients. I would say that our average patients, and I like looking at data, and we've aggregated the data on a 5-year basis. So 65 to 70, 71 to 75, 76 to 7 to 80, 81 to 80, 85, 86 to 90, and 90 plus. And we find that there's a degeneration, in every one of those 5-year brackets. Doesn't necessarily mean that we can't come back and create a better quality of life for those individuals that are at 80 and 90 years old or approaching 100 years old. I think that the new 70 is the new 60, or maybe the new 55. But you have to. Again, we said that earlier. You are what you eat. So be careful what you eat. Just as a sidebar thing, there's a service. There's a gentleman that works, down in the South Miami area, and he's a chef, and he does organic soups. Now, one of the issues that I have is eating all the vegetables that I need. But if I drink a soup, broccoli soup, or a carrot soup with ginger, I'm getting the things that I need for anti-inflammatory. Getting carrot that helps me with my eyesight. With the broccoli, I'm getting so many of the nutritional values. But these are natural fruits, not processed. These are natural vegetables that are then just chopped and put into a soup. The soup tastes good. That's one of the key things, right? But using natural organic products, because you are what you eat at the end of the day. It's very, very key. And I can't tell you how much we enjoy the success stories that we have here, and they come in almost on a daily basis where the people are thanking us, our patients are thanking us, or the families are thanking us. I just happened to receive a phone call yesterday from a family member, and they were wondering why our nurse had not arrived. There's not many services like ours where the family member is keying in on, hey, listen, we're late to the visit. That's how important they think our visit is to the home. That's how much change we've created, how much quality of life we've created. CCMS, our care coordinators are in the home. It's important that you understand how much detail you need to go into. Most of the services out there now, they really don't spend enough time there to be able to find out what are the things that are happening in the home that are social determinants or that are psychosocial determinants that can impair the capabilities. But you need to sit down, you need to ask questions, you need to find out what services are available, consult with other people within our organization to help those individuals and change from where they're at today to where they can be tomorrow. Our care coordinators are there on a weekly basis, and we're constantly training them to be better, to look for more, not to be satisfied just to show up. And a lot of the home services, they're just, all the people there are just there to show up, do their time, and back away and send them bills so that they can get paid. That's not the motive. That's not the idea here. That's not our business model. Our business model is surrounded around the patient. What I say here, when we have conversations, that the patient's number one, the patient's number two, and the patient's number three. And please, you have an opportunity to change someone's life, do so. You can't do it by just going in there and being blindsided, or blinded going in. You need to look very carefully at the things. Sit down, ask them about their food, look at the refrigerator, look at their cupboards, look at their medications that they're taking, see whether or not they're taking them correctly, how many medications they have, are they confused with the medications they have. There's so many things that we do, that our care coordinators do, that are going to be part of the start of a new life, a new quality of life for these patients. Again, thank you, and we'll see you at the next podcast.